When you are planning to become pregnant, optimizing your own health can improve your chances for becoming pregnant and improve the chances for having a healthy live-born baby. Recently, some startling new research has uncovered a previously unknown risk about the dangers of conceiving if you are anemic. Please stay tuned. What does it mean to have anemia? In simple terms, anemia means you don't have enough healthy red blood cells to carry enough oxygen to all the parts of your body. Your doctor can determine if you have anemia with a blood test called a CBC, or complete blood count. A CBC has a lot of different measurements, but the two which are used to determine if you have anemia are the concentration of hemoglobin and hematocrit. Hemoglobin is the protein inside red blood cells which actually carries oxygen. Hematocrit is the percentage of your blood that is made up of red blood cells. If either or both of these are low, then you have anemia. There are many different causes for anemia. One of the most common is not getting adequate amounts of iron in your diet. In women, losing a lot of blood each month with your period can also result in iron deficient anemia. There are also genetic mutations that can affect hemoglobin. Regardless of the underlying cause of anemia, having it before and during pregnancy can cause complications such as ovulation problems, preterm birth, low birth weight, and postpartum depression. Recently, scientists have found another very serious problem: birth defects, specifically birth defects involving the heart. Congenital heart disease is a general term for any structural abnormality in the heart present at birth. This is the most common class of birth defects, affecting 1 to 2% of live births worldwide. About 30% of congenital heart defects have a genetic cause. This leaves a significant percentage that could result from environmental factors. As the heart forms in the developing embryo between weeks 3 and 8 of gestation, anemia early in pregnancy may be very important. Researchers looked at a couple of large databases in the UK. Specifically, they wanted to look at women who had a hemoglobin test in the first 100 days of pregnancy who did not have any congenital heart disease themselves. Then they determined whether these women had a baby diagnosed with congenital heart disease in the first 5 years of life. They identified 2,776 pregnancies with an affected baby and compared them to 13,880 pregnancies in which the baby was not affected. What did they find? The mothers of babies with heart defects had anemia 4.4% of the time. The babies without heart defects had mothers with anemia 2.8% of the time. In other words, the chances for giving birth to a child with a heart defect was 47% higher in mothers who were anemic early in pregnancy. Most cases of anemia are due to iron deficiency, which is treatable. We don't have large-scale studies which show that treating anemia before pregnancy will reduce the risk for congenital heart defects, but given the current data and multiple other issues associated with anemia in pregnancy, aggressive treatment before you get pregnant seems pretty reasonable. Infertility TV is your most trusted source for accurate information on infertility and miscarriage. If you are not a subscriber yet, hit the subscribe button right now. A new episode is released every week. Don't miss any episodes. You can also check us out on our website, ivf1.com, where you can become a patient.